Let's get another update for you now on the Nehawu strike outside hospitals. Joburg's Charlotte Maxeke Hospital now, and the Nehawu workers still blocking the main entrance. Our reporter Ahmed Kajee is there. Ahmed, good afternoon. We know that entrance was blocked this morning. What's the situation there now?
Good afternoon, Stephen. The roads continue to be blocked around the Charlotte Maxeke Hospital. There is some traffic coming around the Wits University Health Campus, so there seems to be some traffic flow from there. But that main road coming into the Charlotte Maxeke Hospital has been completely blocked off with rocks by Nehawu workers. I'll just ask my colleague Leander Tladla to maybe just pan to the right of your screen to see exactly what is the situation over here. The workers have continued this strike since the beginning of this week. They are calling for those wage demands to be met. That is that 10% increase. They say the budget speech which had come through from the minister last month on that 3% increase is unacceptable. Many of them saying that they haven't received an increase over the last 3 years due to the COVID-19 pandemic, and with them being at the forefront of it all in terms of being first responders during the pandemic, they deserve that increase to come through their way as well. This is something that's expected to continue throughout the course of tomorrow until some sort of meeting and some sort of compromise is met between government and the unions as well. But I think now is also a good time to actually bring into the conversation the Gauteng Department of Health's Motalatale Modiba. Thanks very much for your time, Mr. Viba. Unfortunately, we're seeing yet another hospital around the province being blocked off. The patients aren't receiving the adequate health care that they should be getting.
Well, indeed, Ahmed, we do have several of our facilities that have been impacted because of non-access, that patients are not able to access the facility, and also some of the health workers who want to come and assist patients are being prevented from obviously accessing the facility. The no work, no pay obviously rule will apply, but I think it's important that we indicate that we don't support the intimidation of workers. We don't support the acts of violence that we've seen in some of the other facilities. We don't support the issue of destroying of infrastructure. The issue of striking is a constitutional right that is there, but I don't think that right should be exercised over other rights, as in the right to access to health care and so forth. Patients that are coming to facilities should still be allowed to come in to access care. We've got people that are critical in terms of needing care immediately, and I think it only makes fair point that those patients be allowed to access services inside. And I think we've called on obviously the law enforcement agencies to assist, because obviously this is outside the parameters of the hospital. There's very little that we're able to do outside of the parameter of the facility, and it becomes a terrain of law enforcement agencies in terms of stepping in and being able to obviously assist.
What is the nature then of the negotiations between government, the Department of Health and the unions, who obviously want their demands to be met?
The negotiations are led by the Department of Public Service, and I don't think I'm in a position to can actually even talk on that, because we're not sitting in that table. But I think at the national level, there are continuous engagements that are taking place there, and I think GPSA would probably be better placed to actually elaborate on the extent of the engagements and where things are. Ours as Gauteng Health is to focus where we are insofar as the issues around patient care, which obviously at this stage is affected, because some of the facilities are not operating at optimum. We've got skeletal staff that is being there to assist under difficult circumstances.
From a triage point of view, you will have emergency accidents coming in, people who have heart attacks, those P3 cases which will be coming into the hospital. How will they get treated? Is there any way that their families will have any assurances of what they will be expecting?
The situation is different across different facilities. In some facilities, there's better understanding in that those vehicles will be allowed in to at least allow the patients to receive care. In others, it has been a complete no, where patients have had to be turned away. And I think the advice that we've given to patients there is that where patients are not able to get in, they can use at least some of the other close-by facilities that are not as impacted as the facility that they would have been turned away from.
Mr. Motalatale Modiba, thanks very much for your time today. That's Mr. Motalatale Modiba from the Gauteng Department of Health. Stephen, just giving us his explanation as to what is taking place at the hospitals, and just speaking to what we have seen over at the Kopanang Hospital in the south of Gauteng. Operations have almost completely ceased with just executive management, 7 or 8 members of staff just trying to carry out the food deliveries to the patients over there, and it seems that this is going to continue at least heading into tomorrow, with healthcare services being compromised or completely suspended at hospitals across the country. We obviously will be continuing monitoring this particular situation as it goes on today and through the rest of the week. Stephen.
Ahmed Kajee, thank you very much indeed. Really do appreciate it. Well.